Welcome to the Careers Unfiltered podcast with Mentoria. You may know your dream job, you may know your dream career, but do you know what goes on behind the scenes in your chosen career path? Have you been able to separate the glamour from the reality in your career? Do you know the good, the bad, and the ugly in your career? Most people walk into their careers without having any idea in terms of what really happens in that career, how to crack success, how to get the right job, how to grow in the career. Don't be those people. Get the ins and outs of your career path through some of the best subject matter experts and industry professionals that Mentoria will bring to you on the Careers Unfiltered podcast.
Health psychology is very upcoming in India. It's it's something that people are very curious about. Health psychologists traditionally do work in hospitals. They do work with physicians and basic health providers to basically support the treatment plan and also provide a holistic treatment to the patient, not just the physical aspect of it, but like the behavioral health aspect of it. Anything related to psychology has to do with understanding mental well-being and behavior of anything living. Usually we refer it to human beings. With regards to health psychology, it's mostly approaching health condition, the physical, the consequences of mental health affecting the physical health, and approaching it from a very from the lenses of positive psychology, because in contrast with other branches of psychology, we approach it like the health psychologist approach it from a place of where we want to improve the the quality of life of the patient and the caregivers. So it's all from a very positive angle, more than seeing them as a bunch of symptoms. After 10th basically is where we need to little bit get some idea about where we are headed. If someone wants to pursue psychology, whether that's BA, pursuing humanities, just makes it very easy. The transition becomes very easy. However, if someone needs to pursue BSc, they need to have some kind of a background in sciences. So biology helps. So the switch that I experienced, like in my integrated masters of sciences in health psychology from University of Hyderabad, was not very drastic, because I had some kind of background with biology and BSc. BA is more just in very layman terms, it would be more theoretical. It would be, you can do much more experiments when you're pursuing a BSc in psychology. You are also much more, I think that's my experience of it. Subjective experience might differ, but you can also get more exposure with regards to research skill sets. Research skill set goes for both BA and BSc, but BSc is more scientific and requires biology as one of the subjects that you have pursued in your. If something drives you to learn more about the subject, and if you relate with that subject a lot more theoretically, I think pursuing it in an academic sense for masters and PhD really makes sense. We do need very good academicians in psychology in India. Since the approach of health psychology is more towards positive psychology, so any courses from positive psychology would really help a health psychologist or aspiring health psychologist. So positive psychology has it's basically in layman terms, in very common terms, it's study of virtues, character strength in an individual. So it includes spirituality, includes study of flow, mindfulness and all those things. So yeah, so learning positive psychology side by side health psychology would. UCLA has good health psychology course, and after UCLA, I think University of Pittsburgh also has good health psychology course, internationally speaking. Um, Oxford University and other universities also have good courses in health psychology or part of health psychology. In India, I feel apart from University of Hyderabad that offers a full-fledged course on it. I think Christ University, Apollo University is one of the two universities that's on top of my head right now that offers. When it comes to certification, I think the more the better. If you have the time, if you have the resources, you can go for it. But it all boils down to your enthusiasm about it. So if you are enthusiastic about a particular aspect of psychology, a particular aspect of your therapeutic approach. So for example, like if a person starts practicing now within 6 months, if they have like good updated profile or if they are working on multiple platforms, then they automatically gain like above 600 client base. So just going by the number of it, you kind of develop your own, niche or the eclectic therapeutic thing that you have that you use in your therapy. So once you have done your graduation mostly post graduation in health psychology, you can change into any field of psychology based on your interest. You can take up developmental psychology. You can do another post graduation degree in that. You can do and fill in your clinical psychology. Many of my friends are doing that. You can also go into any other field that's related to social sciences or humanities, that is social work. Many of my peers are doing that also. You can also like me, you can take one skill set and basically take different skill set of whatever you have learned in your health psychology course and explore different domains. Like education research, there is educational psychology, there is other public health, behavioral sciences, and all those things. Apart from that, you can also like be a generalist or optimize whatever you have learned from organization psychology as a generalist and be a consultant in a consultancy firm. You can get it. So there is an Indian Academy of Health Psychologists. Um, and there are many initiatives started from my department from University of Hyderabad itself. If anyone wants to pursue or get some help, or our psychology community is very helpful. So if anyone wants to get any help with regards to how they can upgrade their skill set or how they can build their client base, or maybe how they can basically work on their therapeutic skills, I would strongly suggest them to contact the faculty or the recent graduates or the graduates from a particular university. Given that they already have some kind of a training, given that they already have some kind of real life experience, they really would be the best person to tell you more about it. So there is applied psychology, behavioral psychology, there is clinical psychology, social child and development psychology. There is a path where you decide to be a health psychologist only. In India, it's still upcoming. After clinical psychology, there are developmental psychology and health psychology. So it's still upcoming. But if you decide to be a traditionally health psychologist, then I think empathy, compassion, and just having a pure curiosity and very patience is very much required, like as a character strength to be a good health psychologist. Then there is a non-traditional path where you take the knowledge and know-how of whatever you learned in health psychology course and you implement in different domains of different sectors in whatever you are trying to pursue, whether it's corporate, whether it's academic, whether the skill set that has helped me from health psychology course has been mostly with regards to communication, with regards to empathy, with regards to organizational psychology courses that I had like 2 semesters. I think those were the skill set that helped me with the practically keeping yourself updated on LinkedIn, keeping your profile active. With regards to if you have your own blog page, if you have your own top made page or anything that basically endorses the skill set that you have, particularly as a um, therapist, mental health therapist. I think keeping that up to date and regularly posting about your content and about your niche is something that is going to bring more like When it comes to psychology and practicing psychology at a freelance basis, I think apply to more platforms, get more experience, more than getting more certificates, because certificate would change the aesthetic of your resume, but it all comes down to the enthusiasm that you or the hours that you put in to build your client base. So yeah. My day starts from 9 to 6. I work in an NGO that is working on nutrition public health aspect. So I work as a partnership manager there. So I complete that work till 6:30. Yeah. And then after that I take like 1.5 hour break. And then on and off from 7 to 12 o'clock, sometimes 1 o'clock in the night, I have my own session, have my own practice. So traditionally speaking, health psychologists work in a hospital sector, in a medical sector, where they are directly in touch with the caregivers, where they are directly in touch with the patients, and they work with the patients. They timely diagnose the mental health factors, and also the progress of chronic illness, whatever they are going through. Mostly health psychologists deal with patients with chronic illness, because they require much more dedicated support, and holistic support. They are mostly working with physicians, they're mostly working with nurses, and time and again they provide counseling services. They provide grief bereavement counseling, and so they help, and they directly work with the physicians. And if anyone wants to freelance up, as a psychologist or as a therapist, there are many platforms that require mental health therapist, and they are continuously recruiting people who would work remotely. So you would not even have to go to the office. You just need to have a working laptop, and you can start earning there and there. So if someone is a working professional already, I think they should first of all go for any distance learning course or any open university that is offering course in psychology. They should have some beginner level knowledge of what are different branches and schools of thought in psychology. After completing their graduation is where they would have some kind of an idea about whether they would want to further specialize into some aspect of psychology, like organization psychology or clinical developmental psychology, or just take the learnings from whatever they have learned in the bachelor's, and then applying it for other work in their particular domain itself. So going for distance learning while you're pursuing a job, when you already have a career in your hand, might be the best course of action. Health psychology is very upcoming in India. It's something that people are very curious about. So if you traditionally choose to be a health psychologist and get employed in a hospital, then managing our expectations with regards to how much is that going to go a long way. For example, when I had an option of being a health psychologist in a hospital, um, that would at the time was not paying as much as me pursuing anything in the research field. So comparatively, if we have like if a person has a lot of dedication, a lot of attachment towards practicing health psychology traditionally, I think they should not, money should not be a factor, employment should not be a factor. They should just go for it and bring the enthusiasm to the table, and any hospital would be grateful to have them. However, if they don't find traditional ways to practice health psychology, they should not be disheartened, because community psychology and public health, behavioral public health is very upcoming also, which with in the aspects of research and the aspects of it translating into something of a consultancy or being a generalist more than being a specialist. So that also is a side where people can explore. branch. So if one has to go in an academic direction, I think like pursuing your bachelor's, master's, and right now I think even master's is not necessary to pursue PhD is the way to go. Clearing net exam, UGC net exam, and all those things is like way to pursue your academic interest in psychology. When it comes to like non-academic approach of it or application part of it, I think going to a hospital and just seeing if they have heard about like health psychologist, or even if they haven't, like just endorsing what you can bring to the table, the skill set that you can bring to the table, supporting their treatment plan, and like providing a holistic treatment plan is something that you can like obviously explore if you are interested in practice in hospitals. I think like having a PhD is also like going to go a long way even if you are practicing. So that will obviously like determine the pay band that you are given, when even it is you learn whatever you want to learn from health psychology, and then imbibe like the public health aspect of it or community health aspect of it, and then like transition into something that is a little different from practicing health psychology in hospital, but is still in an organization setup. So, for example, I did like apply my research skill set in at NCRT in education research, and then my transition to Indian Council of Medical Research, I did bring in a lot of skill set and a lot of knowledge that I gained in the health psychology course in public health, and I got an opportunity to publish papers in public health also. Uh, it's a very compassionate area of working, and third is there is innate satisfaction when it comes to like if you really like to talk to people, and if you really like to relate with what they are telling, if you're a good listener, if you're an empathetic listener, health psychology is a good thing for you. So abroad, it's a different picture altogether, because in like if one has to pursue their masters or like further education in health psychology abroad, they have much more thorough and comprehensive course there. So there is a different level of certification, and like the licensing is different and everything is different. If I have to speak traditionally, how much a health psychologist done, like I'm assuming that they have done their post graduation in there field. I think they're paid starting from 15K to like around 35 to 40K per month, based on like the skill set that they bring, and how they are able to negotiate the uh, payback for themselves. Yeah. I've recently like gone through some memes or some stories. I don't know what was it, but people are getting counseled by ChatGPT. And that's the funniest thing. If AI can mimic empathy, I think humans should be very scared. And anyway, the point being, the AI coming into like a field like psychology, I don't think any AI or any technology can completely mimic empathy. They can like obviously tailor such responses that feels a little bit more empathetic, but uh, a gradual dynamic empathic approach that like empathetic approach that comes with like a lot of training is something that is still reserved with the psychology you know aspirant. So I think AI is I don't think it would like invade so much into psychology or like the therapy part of it. Humans would still need humans to interact and like feel better. But on the other side of it, I have got an opportunity to like interact and talk to and also participate in different tech, the app environment of mental health. So I've got the opportunity to talk to like a lot of entrepreneurs and mental health platforms. They have their own mental health platforms. Some are working on their own apps. I was working on my own app. I was working on my own platform. So looking at the technology part of the things, if you really want to have your own uh, product in the market with regards to mental health, AI can be like a very good helper in that sort of field, but it can help you ease the social media marketing of things, or it can help you find more it can make the research part of introducing a product to the market very easy. But I think apart from it, this field is little immune to AI. Yes, I think in the next 5 years, uh, especially country like India would really need for example, if a medical curriculum can just include a chapter or a semester of health psychology, then people would not need health psychologists. But that's where the other part of the debate also comes, where including when the medical approach is very reductionist, it's based on symptoms and everything. Clinical psychologists can relate to doctors more than health psychologists. They would need a human touch of uh, the medical aspect also. So I think health psychology in the next coming 5 years would we would need a lot of professionals in this field, but with the limitation that they are flexible enough with their skill set to be applied in different domains and different settings. So if you are pursuing health psychology, please be very wary of going into too niche of it, um, unless and until you are too determined and too enthusiastic about developing into the health psychologist that anyone from the India refers to. If you're very enthusiastic about the subject, please go for it. But mostly you should be flexible with your academic background, flexible with your skill set, that you can apply to hospitals, you can apply to a clinical background, you can apply to even schools. You should be very flexible in the coming 5 years. I think flexibility is something that would be a innate task from any health.